name is Norm Volsky, your host, and this is the Digital Health Heavyweights podcast.
Thanks, Norm. It's an honor to be here, and it's been fun to work with you over the years.
Hello, and welcome to the Digital Health Heavyweights podcast with your host, Norm Volsky. And today we are thrilled to have Dr. Madhavi Vemireddy, CEO of Clio.
Yes. Hi. Thank you for having me.
Our pleasure. Thank you for joining us. So for all of our viewers and listeners that are not as familiar with Madhavi's background, previously Madhavi was COO and co-founder of Care Tribe. Before that was head of clinical program design and care management products at Aetna, and chief medical officer and head of product at Active Health Management, both CVS companies. As an executive physician leader with over 24 years of experience in clinical and product strategy, advanced clinical analytics, and digitally enabled population health solutions for not only health plans, but providers and large employers, Madhavi has a lot to share with us. As many of you know, Cleo is a Series C startup pioneering global family benefits, trusted by over 200 nice-size employers. Madhavi is passionate about supporting and empowering family caregivers so they can drive better experiences and family outcomes for their loved ones. We're thrilled to have you on the podcast and to hear all of your insights.
Yeah, I'm looking forward to our conversation, Norm.
Me as well. Been looking forward to this one for weeks. So what inspired you to become a doctor?
Well, I would say I became a doctor because my father's a physician. He's a cardiologist, retired now. But also, I think, not unlike many Asian families, there was a lot of expectations around the eldest becoming a doctor. So, number of family conversations about that. So I would say probably a combination of being inspired by him, but also just growing up with that expectation.
All right. Jewish families are very similar. My oldest sister, she's a doctor. So, the theory proves true in my household as well. So what made you decide to pivot from traditional career path in hospital care to become an executive, at health plans and eventually digital health companies?
Yeah. So I was in my third year residency in internal medicine in New York City. My program director at the time was Greg Steinberg, very well respected, really smart guy. And, basically 2 months before I completed my residency, he left the hospital to become the chief medical officer at Active Health Management. It was a company that was started by a cardiologist, and so he was recruited to join. And then when he got there, he realized he would need to hire a number of physicians to join the company as well. So he recruited a number of us after we completed our residency and to join. And quite honestly, I really didn't know what I was getting myself into. At the time, digital health wasn't a thing, right? And so it was really early days. This was 2000 when I joined Active Health Management. And so I said, let me try it out for a year and see what happens. And I got there and I loved what we were doing. We were essentially digitizing the evidence-based literature.
Love that. Well, the rest is history. We're glad you, stayed the course. Just out of curiosity, your family, it sounds like your dad was a practicing physician. Like, was he supportive or was he a little skeptical?
I would say skeptical, definitely, because it was just not the typical path, especially after you finish your residency. I was supposed to actually become a hospitalist and probably would have gone down that route if not, given the opportunity to join this startup. So, yeah.
That's great. So let's begin discussing your career at Active Health Management and Aetna, leading the development of advanced analytics and population health programs. You developed and scaled comprehensive programs supporting members across the entire healthcare continuum. Can you kind of walk us through that experience?
Yeah, absolutely. So I spent the first 10 years of my career at Active Health, leading the development of our analytics platform. Essentially, the company was founded for two reasons. One, physicians only had access to the data within their four walls, right? So they really didn't know, especially if their patients were seeing multiple physicians, what care they were receiving, unless that patient was, really on top of everything and sharing everything that was happening. The second real, issue that we were trying to solve was the fact that most physicians are behind in the evidence-based literature. It's like you learn the most that you're going to learn while you're in med school and in your residency. And then after that, it's really up to each individual physician to sort of keep up.
Yeah.
And so essentially we were working with health plans to pull in all the claims data. We worked with PBMs to bring in the pharmacy data, and then with lab vendors to bring in all the lab results. And so we aggregated all that data together, really to create this longitudinal patient record. And then we built rules based on the evidence-based guidelines, and to identify like which patients were getting the right care, which ones did we see gaps in their care, and where we saw essentially errors of commission as well, not only omission. And so essentially communicated that out to patients and to their providers to tell them like there was an opportunity here to improve the care of their patients.
So you're saying the average physician doesn't just go to the library on the weekends just to study up on most recent findings by their peers?
No,
Okay.
that's not typically how it works.
Interestingly, my grandfather was a radiologist. He ran the radiology department at Akron Children's and then eventually Cleveland Clinic. And
Yeah.
he was, I guess, famous for like reading in the library all the medical journals and like reading through the medical libraries constantly. And then also having like a lecture that a lot of people in the city would come to, some even from out of state, to like listen to his radiology lectures.
Yeah.
So he was a student of the game, but apparently that's few and far between.
Yes, he was the exception.
Yeah. Yeah. So what were your greatest learnings, from Aetna and Active Health?
I think probably one of my greatest learnings is in my early days at Active Health, right? We had basically a pretty large clinical team. We had physicians, pharmacists, nurses, and our role was essentially, building out our analytics suite, risk stratification, predictive models, quality measures, our gaps in care. And then we had a separate team that did the care management workflows, and a separate team that did our member facing, digital products. And we were all, each of us were in our own silos, right? And then occasionally we'd come together and realize, well, wait a second, if I had known you were doing this, we could have done this a lot better and a lot smarter, drive better outcomes. So it wasn't until 2010 when I became chief medical officer and head of product that I had all of those teams reporting into me. And I think the greatest opportunity was just bringing this multidisciplinary team of the clinicians, the care managers, the product team, the program designers, looking at, starting with like, what outcomes do we want to drive? And then working backwards to say, well, how are we going to get there? Right. And, and I think that was really what was special about, my time at Active Health, is that we were able to bring these teams together, work collaboratively, and really drive outcomes and demonstrate it.
Yeah, I love that. What was the successes that you're most proud of from that time?
Well, I would say from that time, we scaled our product offering to serve 22 million lives. And even today, I left Active Health and Aetna. Active Health was acquired by Aetna in 2005, but we still functioned as a independent subsidiary. We were able to roll out what we called our Care Engine analytics really across Aetna's book of business, and it's still there today at CVS Health. So a lot of those capabilities that we built are still in production and being deployed across, many more millions of lives, which is really great to see that live on.
What were the greatest challenges? I'm sure, now that you've started to move into smaller companies that are more nimble, what were some of the biggest challenges you had then, Active Health in the early years and then eventually Aetna, which is, a Fortune 20 company?
Yes. I think the biggest challenge was, as we became more integrated into this larger, organization, you really came across a lot of silos, right? A lot of different teams working on sort of, their initiatives. And so you saw the opportunities for more cross collaboration to get things done faster, but it just took longer to execute. I would say, you'd see the missed opportunities, right? To really drive development and more value to our customers. And then the other challenge was that sometimes you'd always felt like strategy was changing every 2 to 3 years as new leadership came in. Right. And so I loved my time at Active Health. I was there for, 18 years, and I think in large part because we still functioned as a small company, even though we were under sort of the broader umbrella.
All right. Well, after 18 years, what inspired you to found Care Tribe?
So, Norm, I'm the mom of two boys. My eldest, Zavi, is almost 14, and my youngest, Lon, is 10. My eldest, ever since he's been born, I've been actively caregiving for him. So he was born a few weeks premature. We were told he had congenital heart disease. He received surgery within a few days of birth. And then he essentially had another congenital heart anomaly that we thought, was stable, we could fix later. The first 9 months of his life, he essentially had failure to thrive. I felt like we were seeing different specialists every single week. We were trying to figure out why he wasn't able to drink his milk. He was getting sick all the time. We were in the NICU for 6 weeks, and then we were in and out of the PICU. So it wasn't until probably like age 6 or 7 months that we figured out that it was actually his heart that was causing all of the problems, and it was the reason why he was missing all his milestones. And then when we figured out it was his heart, we had essentially where he was getting his care was Cornell, and they said, "Listen, we've only seen a handful of cases.
Wow.
We recommend doing open heart surgery, but we don't know if that's going to cure symptoms, right?" And so we basically had to get virtual consults from, CHOP and from, Boston Children's. We ended up going forward with the open heart surgery when he was 9 months. He was only 9 pounds at 9 months. And fortunately, that fixed the issue. And he started gaining weight. And so we really thought we were on the path of catching him up. And then at age 5, he was diagnosed with being on the autism spectrum. And so today at 14, he is minimally speaking, still has significant motor delays. And so, my husband and I we're actively caregiving for him. We have to support him with all his self-care. And we're, trying to figure out everything that we can do to help him communicate and help him to reach his, fullest potential and be independent, right? That's our goal for our children. And so I think through my last 14 years experience, when I left Aetna, my husband was in between jobs as well. And we said, what are we going to do next? And for us, we really need to solve critical problems, things that we are passionate about. And I think through all my learnings on the professional side, building population health programs, working within a large health plan, realize we really don't touch the caregiver.
Yeah.
And being a caregiver myself, despite the fact that, my husband and I are physicians, we struggled. We had once, when our son was diagnosed, we're like, what do we do now? And these aren't questions that your pediatrician can answer, right? They don't have all the solutions, right? And so you get connected with other parents, you learn
Got to navigate the whole system, which is incredibly complex,
thinking about all the different therapies, physical therapy, occupational therapy, speech therapy, functional medicine, right? And some things work, some things don't work. And you're constantly trying to, put together this plan. And meanwhile, as a caregiver, you're going through incredible amount of just strain and stress. And when we started to look at the market and saying, well, what's happening in the caregiving space? Who's supporting them today? we realized that the companies that were there focused on caregiving support were really focused on more concierge support
Mhm.
versus a population health approach to supporting caregivers.
Yeah.
And it really felt like we had this opportunity to take all of our lessons learned in
Mhm.
population health, right, that we do so well for care recipients, but really
Yeah.
apply it to caregivers and said, hey, it doesn't matter if you're taking care of a child with special health care needs, if you're taking care of your spouse or partner with a cancer diagnosis, or you're taking care of your parent with dementia. We need to figure out how we educate you on that specific caregiving situation that you're in so
Yeah.
that you're empowered to
Mhm.
drive better health outcomes for your loved one. But at the same time, we need to monitor your health and, your physical health, your mental health, your caregiving burden, so that we can make sure that you are not on that path to burnout, which so many caregivers are, today.
Very true. And I empathize with like your whole journey. I probably have a better insight into, what you went through than most, in the sense that my wife is a speech language pathologist in an
Oh,
autism clinic. And it's
okay.
not just local to Cleveland. She has students from all over the country that
Wow.
live on campus. And, the whole idea is, yes, to allow someone who is nonverbal or close to nonverbal being self-sufficient and being able to live on their own and support themselves, and really live a fulfilled life, despite having certain challenges and certain
Absolutely.
obstacles that they need to navigate. It's the work my wife loves, and I hear about it every day, and it's definitely very difficult to be a caregiver, but it also can be rewarding, when you see progress.
Oh,
So
absolutely.
yeah,
Absolutely.
it's great to see like some of the students she's worked with for years, and like watching them blossom. It's just, she's a miracle worker herself. So, how did Care Tribe combine an analytically powered digital health platform with human expertise to support children and adults with special healthcare needs, including elder care?
Yes. So essentially, what we did is we said, again, taking our population health framework, we really need to understand where families are,
Yeah.
right? And so just understanding who they're taking care of in their family. And at Care Tribe, we were very much focused on, if you're taking care of a parent or an elder loved one, or you're taking care of child's special needs. And to, we built out pathways for autism, for cerebral palsy, for dementia, Parkinson's, and even healthy aging. Because our goal was like, no matter where you were in your
Mhm.
caregiving journey, like you may not, many of us don't even self-identify with being a caregiver because
Yeah.
we're helping mom and dad, right?
Mhm.
With day-to-day chores, helping them with finances or taking them to the doctors. But that is caregiving. You're supporting them with their day-to-day functional activities.
Yep.
And it's stressful because it's just taking time away from, your full-time job, or, your own responsibilities with your own children. And it definitely has an impact on your well-being, especially the
Yeah.
more activities you support, the greater the impact. And so it was important for us to identify those that are early in journey, educate them of like what it even means to be a caregiver so that they could recognize that that's what they're doing
Mhm.
and that there's help. And here's different ways that we can support you. So, we had a team of social workers, they're master level social workers that we brought on board. They, really helped with a lot of the navigational support.
Mhm.
Sometimes it helped find housing for an employee's parent. Sometimes they were finding local meal delivery or finding an in-home care provider or looking at, senior housing options. And then at the same time, really helping to focus on the caregiver themselves to
Mhm.
say, like, how do we help you focus on your own self-care
Mhm.
and your own emotional well-being? Because if you burn out, who's going to take care of your loved one,
Yeah.
right? And really trying to drive that as because there was so much guilt I think that caregivers have, like, oh, how can I prioritize myself
Mhm.
when I'm taking care of mom or when I'm taking care of my child? Like, I've my work to do, I have things to do for the family, and then usually the caregiver, and the majority of caregivers today are women,
Mhm.
they're at the bottom of the list.
Yeah.
right? And so it's really helping to drive that awareness around the importance of taking care of yourself so you can be there to take care of your loved ones.
You can only fill others' cups if yours is full yourself.
Exactly.
So,
That's right.
yeah, it makes a ton of sense. What are you most proud of from your time of building Care Tribe?
So I think what I'm most proud of is the fact that my husband and I, we bootstrapped that company.
Mhm.
We launched and actually signed our first customer right before the pandemic, literally a week before the pandemic hit.
Yeah. Was
Uh,
it a corporate, like a employer? Was it a health plan?
it
Like,
was an employer. It was an employer here in Silicon Valley.
hmm
Um, and and then the pandemic hit and all of the marketing efforts that we were planning around conferences and, at the same time, even investor meetings, right? All of that shut down.
I
And
still
so,
remember being in New York for conference board,
yeah,
and like this whole, world crisis just becomes on our doorstep with like people in the US starting to get diagnosed
yeah,
with COVID. And it was as apocalyptic as I could imagine. People were like trying to get out and get on flights and rent cars. Like it was a mad scramble. And yeah, that was the last conference I went to for 2 full years,
right.
probably at least.
Right. So, it was tough. It was tough starting a startup when everything is shutting down on
Yeah.
both fronts, on finding customers, right, getting the word out, as well as getting investment. And so we really had to stay resilient. I think we believed so much in what we were doing, and we saw the help that we were providing to members, right, and the need, and knowing that like this is a significant gap in our healthcare system today. And so we just hung in there and did what we could. And so that led us to exploring partnership. And that's how we met with the Clio leadership team at the time. And, Clio was founded in 2016,
Yep.
focused on maternity management and expanded into parenting support during the pandemic.
hmm
And a number of their customers were asking, well, what about adult care?
hmm
Right? Thinking about the sandwich generation, because many employers really had different vendors. They had a, vendor for, supporting the pregnancy journey and parenting, and then another vendor for adult care, maybe even a third vendor coming in for kids with special needs.
Yeah. And
Um,
there was a vendor probably for fertility treatments
oh yes,
as
absolutely.
well.
Absolutely. Right. And then when you step back and you think about it, well, you've got families that are going through sometimes multiple of these journeys at once. You could be going through fertility. I think about my own experience. I was going through fertility treatments to have both my children, but
Mhm.
for my youngest son. And when my youngest son was born, my father-in-law was diagnosed with terminal brain cancer, and we went through a 9-month journey. Right, so I had a child with special needs. I had a newborn at home. And I was going through a terminal illness, for my father-in-law. Right. And it's just how would I get support from 3 different vendors for that? That doesn't make any sense,
Yeah.
because then you're missing the picture.
You're making it harder, not easier at that
You're
point.
harder, not easier, and you're missing the picture around like the stress that's happening because you've got multiple care journeys happening at once. And so when we came together with the Clio team and we were really talking about, the sandwich generation and just thinking about
Mhm.
incremental value of bringing the two companies together, that's really sort of what led to, hey, this doesn't really feel like a partnership. It really feels like we need to, acquire you and bring you onto the same platform.
That's fantastic. I love that. So after the acquisition, you became chief clinical officer at Clio. What was it like joining, Clio post acquisition and go from leading a company to, leading a department?
Yes. So when I came as chief clinical officer, I had oversight of really the integration work
hmm
and outcomes. And through my outcomes work, eventually had oversight of the product team and the member operations team and our analytic teams. And so it was really taking some of the early product concepts that we had at Care Tribe, like our life paths
hmm
for, different caregiving situations. We actually built our family health index, which was looking at 7 dimensions of health for the caregiver. to identify like which caregivers were at highest risk of burnout, which ones had mental health strain, taking that outcomes lens and saying, let's work backwards and saying,
Mhm.
okay, what are those key interventions that we need to deliver? And then thinking about the member journey, right? If members are coming in and they're pregnant, and the same time that they're pregnant, they're taking care of a parent with a cancer diagnosis. What does that look like?
Mhm.
And so spent the first 6 months after I joined Clio doing the integration so that we could launch the following year in 23 with an end-to-end, caregiving platform.
And what's been the reaction since?
Well, I would say, yeah, we're a year and a half in. The reaction has been quite amazing on two fronts. One is the fact that I think whether it's consultants or employers quickly realized, yes, it doesn't make sense to
Mhm.
have multiple vendors, like to have one vendor support all these care journeys for families is really a critical need.
Mhm.
And so a lot of benefit consolidation conversations. And then we started seeing our competitors on really both sides expand. And so that's probably like one of the greatest validation that you're on the right track. The other area was really around our analytics with the family health index. And because we were talking more about population health, really being able to demonstrate the data that we're seeing, like, we see a third of our families at high risk for burnout. Almost half of them fail a PHQ-4. So they have early signs of depression and anxiety. And I think one of the, so it's really trying to bring to light
Mhm.
fact that we've got a hidden epidemic here. Caregiving is not a line item on your claim, right? So, a lot of times you're focused on, okay, I need a cancer solution, or I need a musculoskeletal solution, or I need a mental health solution because I see the cost for these areas. You don't see the cost for caregiving,
Mhm.
right? It does show up eventually
Yeah.
in your mental health and your physical health, but there's significant productivity costs, and there's an opportunity to prevent that,
Yeah.
prevent the negative impact of caregiving by supporting families early on in their journey.
Yeah, and like company turnover and attrition is also a key indicator.
Absolutely.
And I don't know exactly what the statistic is. I'm sure you have it off the top of your head. But, most people within 6 months of being a primary caregiver, a lot of them will need to take time off. Either it's a leave of absence or just
Right.
a full resignation because they can't juggle both. And
Yeah.
family comes first, as they should.
Absolutely. I think there's been a significant increase in leave of absence related to mental health. And
Hmm.
a lot of that is because of caregiving.
Yep, 100%. So talk to us about that sandwich generation. Those responsible for raising children and caring for elderly parents. Walk us through like why Clio offers something that is truly comprehensive that is hard to match.
So today, if you look across all, US adults, about 23% are in that sandwich generation. If you look at folks in their 40s, it goes up to about 54%.
Mhm.
And we know that number is only going to grow because of the our aging demographics, right? We're going to have probably close to 70 million Americans who are 65 plus by
Mhm.
2030 in the next 5 years. And when that happens, there's going to be more and more, folks in the sandwich generation.
Yep.
And so essentially what that means is I think there's a couple things. One is there is the support for your children.
Mhm.
We saw the US Surgeon General's advisory around parents under pressure.
Mhm.
Even with children that are normal, there's still a lot of challenges, mental health challenges, right? And
Building healthy habits is huge. Like me as a new parent, I'm constantly trying to reinforce like healthy eating habits or going on walks after we're done
yeah,
eating meals, and like instead of watching TV, we go outside and like do different games and activities. It's huge.
absolutely. Positive parenting tips, thinking about, like you said, like, how do I instill healthy behaviors so they're not on their screen all day long, right? If they're not in school. And so if you do have a child with a special health care need, it could be asthma or severe allergies or, autism, there's even more stress that you're going through. And then you go through these transition periods, from elementary school to teen years, right? When puberty hits, now you have a different set of challenges that you have to work through. So already just with parenting alone, there's a high level of stress. And actually we see it in our data because about 40% of them we identify as being at high risk for burnout. Now you add in the sandwich generation where now I'm also taking care of a parent. And if that parent has a diagnosis like cancer or dementia and needs more support for their day to day, right? Then you're just adding more to your plate.
Yeah,
And
plus the financial pressure to either take time away from work and earn less or pay someone to do it, which again, you need to, be able to come up with financially. So there's
right,
so many different factors, that increase someone's stress, and there's
right.
a lot more than meets the eye.
Absolutely. I mean, at least parenting, it's like, okay, we have a sense of like, here are the things we should be doing, right?
Yeah,
Or
and
what
you
to
sign up
expect.
for it.
Yeah, exactly.
Yeah.
You sign up for it, right? But for when you're caregiving for a parent, like you don't sign up for that, right?
Yeah.
And you don't know what to expect. And many of us haven't even had the conversations with our parents to understand, like, what matters to you? What do you want? And of course, most of them want to age in their home, but do you know what that means? And is there, your point about finances? Do they have a good understanding of what that's going to cost when they need to hire a home care provider? Or if they're looking at assisted living, what's that going to cost? Right. And so it's a lot more complicated and you really need to have education around the basics, like what questions should I be asking? And then what should I be doing from a legal perspective? What are those essential documents I need to have in place, or financial planning?
Mhm.
And so when you're just going through all of this at the same time and you are working full time, right? And we see the data around if you do need to cut your hours from full to part time to manage your caregiving, or you have to leave the workforce altogether,
Mhm.
a significant impact on your own retirement savings,
Yeah,
right? And so now you're going to set up this vicious cycle where are you going to have enough when it's time for your own caregiving, needs?
totally. Can you walk us through a member experience for a Clio member?
Yeah, absolutely. So today, when you enroll, you basically tell us what life stage you're in. Are
Mhm.
you going through a pregnancy journey? Are you planning a pregnancy? Do you have children? How old are they? Who else are you caregiving for? Are you caregiving for a parent or a grandparent or a sibling? And then within each care recipient you set up, are you going through basically like a normal, healthy journey based on the age of your child? Or do you have special healthcare needs? Like,
Mhm.
does your child have autism or ADHD or a learning disability? And for your parent, do they have any chronic health conditions? And so once you complete that, you basically, in our platform, you then get queued up with these life paths and their related support plans. So
Mhm.
every member of your family is going to have a support plan where we can identify specific educational content so you really understand
Mhm.
more about that specific condition area, or you understand what to expect based on the age of your loved one. You get matched to a guide
Mhm.
that has expertise in your specific caregiving situation. So
Yeah.
if you're going through pregnancy, we have midwives, doulas, lactation experts. We have parent coaches, neurodivergent experts. We also have dementia provider experts or master level
Mhm.
social workers, right? So you get matched to the appropriate guide, and then you're offered whether it's one-to-one sessions or your ability to message with them async, as well as group sessions, group coaching, because we know loneliness is a big component. So how do we connect you with others that are going through similar journeys? So you're learning from each other, but you also realize, oh, I'm not in this alone. And, there are others like me that are going through this. And then the other key area is our family health index. We really prompt all our families to take this quick assessment. It gives them a real-time report, really simple, red, yellow, green. Where are you doing well? Where do you need help? And it really becomes that call to action for them to engage with our guides. Our guides use it to proactively engage with them.
Mhm.
And then we use it as a tool to track after they are engaging with the digital platform, they're engaging with their guides. We help refer them to other relevant benefits. It really helps us then track improvement over time.
Yeah.
Are they getting better? Emotional wellness is probably one of the biggest areas of focus for us since we have
Mhm.
about half of our families with early signs of anxiety and depression.
Yeah.
And what we've seen is about a 70% improvement because we're
Incredible.
addressing the root cause of that mental health strain. It's let's figure out how we alleviate that caregiving burden, or how do we increase your confidence? Or
Mhm.
sometimes you're taking on all the caregiving responsibilities and you don't know how to ask for help or how to spread it across your other siblings
Very
or
true.
your partner or spouse, right? And so it's really helping with those family relationships so that not everything is on, one person's plate.
Any member stories of individuals that use, the benefit that Clio offers that really stick out in your mind?
Yeah, a couple stories. We had one story of a individual who was an employee at a tech company here in the Bay Area, and basically came to us and said, "Listen, my dad's homeless. He can't afford to rent anything here in the Bay Area, and I really can't afford to buy him anything here."
Yeah.
And he's just been sleeping, on the couches of family and friends a few weeks at a time. And he's like, "Is there anything you can do?" Because obviously it's very stressful for me. "Is there anything you can do to help me find him housing?"
Mhm.
And so our guide, who's master level social worker, went through the county database and said, "Yes, he can definitely qualify. Let me help him fill out the applications," and basically found him subsidized housing,
Okay.
that was close by. And that was huge relief, right? Because it's like, where do you even start to figure that out? Another area was, another family was this couple that had two children with special health care needs. Their eldest had autism and severe allergies. The youngest son had cerebral palsy, was nonverbal, and they were working, but they were working from home
Yeah.
and essentially caregiving full time. And to the point where, they both had gained weight. They weren't taking care of themselves. They weren't sleeping through the night. And so it was a wake up call to figure out what resources could we help find for them. So, we were able to find a home nurse that could come in to help take care of the youngest son, and alleviate some of their, day-to-day responsibilities, but also help them focus on their own self-care.
Yeah.
And, sometimes it's just knowing that you have someone in your corner,
Uh-huh.
right? That you could talk to, you could talk about the challenges, talk about the frustrations, but also knowing that they're there to find,
Mhm.
a solution, right? And we can't solve everything, but it's like, what can we do to make this experience better?
Mhm.
And also make sure that your health doesn't suffer, in the process.
Yep. I talk to a lot of leaders in the digital health market, and something that I hear commonly is we need more clinicians, in tech companies. We've seen your background, as a board certified doctor of internal medicine. Like, how did that help you in your career? And do you agree that, in this tech sector focused on healthcare, we do need more clinicians within the leadership um, teams?
Yeah, I absolutely agree. I think it's really important to bring clinicians and product leaders working together more
Mhm.
collaboratively as you design products, right? Or you design programs. Because as a digital health company, you're always trying to identify, what's our specific area of focus and how are we going to drive better health outcomes?
Yep.
Right, at the end of the day. How
Mhm.
are you gonna make drive improvements, whether it's to the member experience? It's usually a combination, member experience as well as the outcomes, right? So it's not engagement for engagement's sake. And so if you don't have a good understanding of that, and also like good understanding of like what's happening today in the provider's office
Mhm.
or what's happening within care management programs and where are there opportunities for you to drive, incremental value and benefit? And are you fixing a significant, problem, right,
Yep.
that exists, right, or a gap that exists? So I typically see like clinicians are like off to the side doing their thing, maybe looking at policies or, utilization management type activities or providing the care itself, but they're not there really working side by side with the product team. And I think when that, and when you don't have that type of collaboration, you're just going to miss things, right? And you're not going to really optimize the product to drive the right outcomes.
Understood. I think a challenge and why there aren't as many doctors, within these tech companies is ultimately it's a risky move for a lot of doctors. So like, hey, I studied for so many years. I
Yeah,
didn't really start making real money until, my mid 30s. I have a lot of debt. Like I can't take a risk where I leave a high paying, high salaried job to work somewhere where I could not necessarily be there in a year and a half
right.
or
That's right.
maybe even less. So, how can we align incentives to make it easier for physicians to move into tech companies without them feeling as though that is an unnecessary risk they might need to take?
Listen, and I think what I typically see more of is physicians leaving practice
Mhm.
because of burnout,
Yeah.
because of not good work-life balance. They're on calls on the weekends, and then they're constantly feeling, they don't have enough time to make a real impact, right? They've got their 20 minutes with their patients and then it's like in and out,
If
right? Yeah, exactly. If that. And so you do see, for example, Active Health, we had a team of probably 15 physicians, medical directors, pharmacists, because they felt they could impact more people,
yep.
right? Your point, startup there, you don't have that stability, right? Anything could happen. But it is interesting that you probably have more stability working with a larger health plan, but you still have to deal with the frustrations of working with a large organization and getting things done. But I think I've seen many of those medical directors go on to become CEOs and head up innovation teams at health plans. And so, I think there's pros and cons with
Mhm.
each decision, right? So it's really trying to figure out what works best for you and what you're passionate about at the end of the day.
What's your philosophy when it comes to hiring, great teams, especially within growth stage companies?
Yes. So I think the philosophy is really bringing in individuals with right level of expertise. Being in digital health, obviously having folks that have that healthcare background is always going to be a plus, especially if you're looking at building products or building clinical programs or selling to, healthcare buyers. Having that expertise is key. But also is teams that are aligned to sort of your core values, right?
Mhm.
And that are going to be resilient in challenging times and are able to pivot where needed, especially as you expand into new markets. And so I think again, it's you're always looking to find individuals that work well together, right?
Mhm.
Because this is definitely teamwork, right? And so
What are you keying in on, especially at an early stage company? Like, what are the things you look for that probably makes or breaks whether they'll be successful within like a Clio or a smaller organization compared to like when you're hiring, within Aetna, you feel like, okay, these people have a lot of resources. You get someone with X, Y, and Z capability, and there's a lot of support for them to thrive. But in a startup, like a lot of times, you got to wear a lot of hats and you don't have a ton of help. So, like, what are the things you key in for when making hires for a growth stage company that you wouldn't emphasize as much in a big health plan?
I think, to your point, it's the ability to kind of pull up your sleeves
Yeah.
and get in there and work on the details. It's, especially for leaders, like you really have to be able to kind of flex up and down, right? It's, having that strategic vision of, okay, where are there opportunities? Focus obviously on the execution, right? But when something's not working and you need to get in there and figure it out and pivot or reset the teams, like you need to be able to go deep to do that.
Yeah.
And so, I mean, still do that to this day because, again, with my clinician background, I'll say, okay, let's look at these outcomes. Let's work backwards. What are those key interventions? What does the data suggest? Where are there the cost savings? Like, I will go deep to make sure, like, are we connecting all the dots? Because typically that's across multiple teams. It doesn't just sit within one team, right? You've got to have your member operations team, your product team, your marketing team, right? Your analytics team, like all aligned, and it's helping to connect the dots across the way. So, and that's really important for us. Is like your ability to get in the weeds when needed, but
Mhm.
still understand like the big vision strategy of what we need to accomplish.
Excellent. What do digital health nerds like myself have to look forward to, coming from Clio in the next 5 or so years?
Yeah, I mean, I usually say now that we've gone broad with end to end, I think we have a lot of opportunities to go deep in
Mhm.
certain areas. Actually, earlier this year, we launched cancer care support, supporting you whether you are a caregiver for a loved one with cancer or you yourself have a cancer diagnosis.
Gotcha.
Just knowing that there's more opportunities to provide more holistic approach to care, not just
Mhm.
focused on the tumor itself, but on on the whole person and their family and what they need. But I do think there's opportunities, and we're looking at expansion into new markets like Medicare Advantage as an example. And so with that, I think we're also seeing new policy changes, right? There's greater awareness around like how do we better support family caregivers, caregiving training, more
Mhm.
navigational support. And so I do think these areas are opportunities where Clio can go deeper with our services and obviously leveraging AI. We launched our initial AI set of capabilities around, a chatbot so we can provide answer
Mhm.
right then and there based on sort of our proprietary content, as well as, dynamic support plans, right? Knowing as things change, like how do we change our recommendations and give you what we consider your next best action. So leveraging more and more of AI will allow us to drive more of that personalization and really understand for this unique family what's going to drive the best outcomes for them.
Love that. Um, I ask everyone who comes on the podcast, how do you personally participate in wellness? Like, what do you do to exercise and reduce stress in a very high stressful job? And I would imagine you're also like in the sandwich generation yourself.
Yes. So a few years ago, I actually got talked into participating in the New York City half marathon. I'm
Okay.
not a runner. It was for fundraising for my son's school.
Mhm.
And I'm like, I don't think I can do a marathon as my first race,
Yeah.
but I did it and I loved it.
Congratulations.
Thank you. And I was hooked. And so I run, and I typically run half marathons. And for me, I sign up for that race. It's almost like putting it on my calendar. And so now I've got to then put all my training runs in my calendar. It forces me to say, okay, I need to find time for, to do these runs.
Yeah.
And the nice thing is because they're long runs, I get to listen to an audiobook. I
Good.
listen to music. It just helps me, you know, manage my stress better.
Mhm.
And obviously it supports my own self-care. So, which I need being a caregiver.
Yes, very, very true. And I also ask everyone who comes on, I think in the US, it's really hard to even know what healthy eating is because a lot of products are marketed to us that are health foods that aren't.
Yeah.
So, any healthy recipes you make at home that might inspire someone to try something new?
So, since I'm Indian, one of the recipes that I love to make is dal,
Oh,
which
yeah.
is essentially lentils.
Mhm.
Very easy. I make it in a pressure cooker. So just, saute onions and tomatoes. You can use different kinds of dals and you can mix and
Yeah.
match the lentils, right? And which you can find in your grocery store and add some water and tomato and 12 minutes.
That's one of my daughter's favorite things to eat is lentil soup, dals. She's a big
Yes.
fan.
Yes, that's one of my son's favorite things too. So I love it. It reminds me of my mom's cooking, and it's very healthy.
I love that. Great. Yeah. Highly recommend. A lot of flavor, not a lot of calories, and it's all like whole foods, plant-based.
Exactly.
Really, really good stuff. Well, again, Madhavi, thank you so much for joining us on the Digital Health Heavyweights podcast. Very excited to see what you and Cleo accomplish over the next bunch of years. Again, congrats on all your success so far, and we know it's only the beginning. So thank you for joining us.
Thank you, Norm.
Thank you.
Appreciate it. Take care.
Thank you for joining. Please like, comment, and subscribe below if you enjoyed it.